And welcome back. Well, we continue now with our ongoing series, Mental Health Moments with Rogers Memorial Hospital. Well, when you're going through a difficult time, sometimes even a simple chat with a trusted friend or a family member can help.
Yeah, but sometimes we need more help than that. So today, the different levels of help for mental health problems and what type of help might be best for you or for a loved one. Joining us now from Rogers Memorial Hospital is Sue McKenzie, along with Dr. Tracey Cornella-Carlson. Great to see both of you.
Thanks for being here, ladies.
Thank you so much. We have this really cool pyramid that you sent to us. It's kind of a visual example of the different levels of care. And I think a lot of people don't know exactly at what level to enter in if they think they need help. So let's talk first about that very first level.
And that first level impacts all of us. It's those protective factors that help us in some ways build our strength to be able to face any challenges that might come. And the protective factors are both internal resources and external resources. So the best example I could think of was your internal resource of self-confidence is awesome. And many of us have that. We're, at 2, we're self-confident little beings. And then when we go to school, we might run into teachers who are an external resource that helps us to maintain that self-confidence when we face challenges at school.
Okay, so those community factors, as we're looking on, those community-based factors, as we kind of go up the pyramid and we talk about being mentally healthy, how do we come to terms with that term? How do you know that you're mentally healthy?
So there's typically 3 things we look at to say that I'm mentally healthy, and that's when my mind allows me to engage in productive activities like work or school, when I have fulfilling and healthy relationships, and when I'm able to adapt to change and to handle adversity when it comes. So when you think about that, that's kind of a neat goal for us to have for ourselves and our children, that we're able to be productive, have great relationships, and face life as it's dealt to us.
And I know you're a big believer in that word resiliency, and that's something that as parents we all want to give our kids. And it can be challenging when they don't feel so good, especially mentally. Let's talk too about mental illness challenges. They're common. I think a lot of people though who've never experienced it might think, doctor, oh, this could never visit my house.
Absolutely. And, sometimes people are aware that they have a mental health challenge, but they simply don't know where to turn.
How can people be aware of it before it becomes a bigger problem?
Well, really, we recommend screening, and screening is the first level where a mental health professional will review someone's particular situation and try to give the best recommendation for the most appropriate level of care based on the severity of the illness at the time. And while we're approaching National Eating Disorder Awareness Week, I wanted to also mention that that week starts February 22nd and goes through the 28th. And a key goal of that week is to direct people to free online screening for eating disorders, and that can be done at mybodyscreening.org.
And so even taking a survey like that or answering a lot of questions can help doctors figure out if you're somebody who maybe needs treatment where it's something that's impacting your relationships or your mental health.
Exactly.
Let's talk a little bit, Sue, about a great video that you brought of 3 different women as it kind of helps us better understand the levels of care.
Sure. So first you're going to meet Brittany, and Brittany is actually a past patient of Rogers, and she dealt with eating disorders and substance use challenges. And then you're going to meet Val, who from very early on had intense ADHD. It's a wonderful, all 3 of these stories are on our website to be able to hear their full story. But so that's Val, and then last you're going to hear from Rosa. And I love to play Rosa, especially for educators, because she's a young woman who in middle school started to feel depression, and because she wasn't acting out, there weren't behaviors that were problematic in the classroom, she just slowly went into a place of darkness and was really missed until she finally actually dropped out of high school. And she even has a place where she talks about laying on the couch at home and hearing the school call and say, Rosa's not here today, and yet no one checking to see why she wasn't, and she dropped out. And her mom, who only spoke Spanish, was the one who tried to figure out, how do I navigate the system to get my daughter some help? But the pieces you're going to see are them talking about, they're living lives of recovery, awesome young women, and they're going to talk about some of the ups and downs, but the pervasive hope that exists in that path of recovery.
All right,
it's
wonderful. Let's take a look.
And so there's been times where I've feared that I was heading for a really bad relapse. And I've kind of stepped up my treatment. I did go back to a partial programming program for 3 weeks at one time. And I've, seen different outpatient therapists. I really learned so much from that long treatment process. that I've never been able to like completely fall back into my old ways because I like am so much more self-aware.
I sincerely believe that recovery is a process, and like any process, there are going to be ups and there are going to be downs. I was talking about my ADHD long before I suffered setbacks last year, and as soon as I did, I went right back to counseling, and I went right to my psychiatrist and asked for the dosage increase because I'm not in denial. You know, I'm not superhuman, and I'm definitely no poster child, so I'm not infallible. There's no reason that that wouldn't happen, and I didn't want to live like that.
The most valuable thing I got out of this is that recovery is a work in progress, and you need to keep living every day to the fullest. Even though you're gonna have good days and bad days, just know that the challenges, they're not there to take over your life. Like, don't let them. You're always above that.
So these
Such
girls,
young girls.
yeah, and they each experience a different level of care, right?
Absolutely. Brittany and Rosa experienced the inpatient level for starters, and that's a brief period of stabilization. And from that point in time, we tend to move people to other levels of care to complete the recovery process. All three of these young women were able to access the community level of care, which is outpatient treatment, which is on a frequency from 1 to 8 times per month. But sometimes it's important for people to have more support, and we also offer day treatment programs, or what we call partial hospitalization programs, that can be anywhere from a half day to a full day program. And if appropriate, sometimes people still are involved in work or school while going to these programs. But sometimes it's really important for people to remove themselves completely from their home environment and spend a couple of months at Rogers for residential treatment. And during that time, they learn wonderful coping skills and get to the point where they're feeling comfortable to get out and live a life that they really feel is worth living. And it's a wonderful opportunity for us to see this resilience that Sue had alluded to, and we feel very hopeful about many of the outcomes we've been able to be part of.
Yeah. It seems like it could be scary to leave someone in an inpatient or intensive treatment, but the fact that, you see these stories of hope and how far they've come and how much it's meant to them and how resilient they're becoming, I think it just speaks volumes. So we want to make sure everybody's got the information so they can contact Rogers and see more about your recovery stories. Those are all online at rogersinhealth.org. You can watch the full stories there. If you need help or you want to contact Rogers Hospital, it's rogershospital.org for more information. Thanks so much for being here, ladies. Important conversation.
Great to see you. Thank you so much.
Yeah.